Thanks for joining us. Now, Joy News has uncovered how the president of the National Diabetes Association of Ghana, Elizabeth Denyo, undersupplied hospitals with sponsored insulin meant for free distribution to children. A memorandum of understanding signed between the association and Australian donor agency International Diabetes Foundation or Federation is to provide insulin freely for children enrolled under the Life for a Child program. But checks reveal differences in figures of insulin sent to the Diabetes Association and what was supplied to the listed health facilities. Joy News' Kwete Nate reports how officials selected by the Diabetes Association to distribute free insulin and glucometers sold it to poor patients.
There is an intervention to ensure that no child dies from diabetes. That's the partnership between an Australian donor agency, International Diabetes Federation, and the National Diabetes Association of Ghana under the Life for a Child program. A memorandum of understanding signed between the two bodies states that children living with diabetes are to be supplied with insulin, glucometers and strips free of charge. Elizabeth Denyo is the president of the association.
We're looking at people living with diabetes nationwide, but our special attention is on children living with diabetes. The Life for a Child Foundation is a branch of the International Diabetes Foundation. Their mission is no child should die of diabetes. So currently throughout the African sub-region, we are making sure every child living with diabetes at least gets strips and to test their sugar, glucometers to test their sugar, and insulin to keep them alive.
But there is a rip-off of these vulnerable patients living with diabetes. Joy News checks reveal some officials appointed by the National Diabetes Association of Ghana are selling the strips and glucometers instead of distributing them for free to the poor patients. This was how the hotline team uncovered this. I posed as a research officer conducting a survey for the donor agency supplying insulin to the National Diabetes Association to investigate claims of the drugs being sold to patients. At the Wa Hospital, retired nurse Mary Diano is the medical officer appointed to distribute the specially labeled diabetes drugs at the hospital to persons living with the condition. But she was selling the diabetes strips and insulin to her patients. This was what transpired when I put the issue to her in a telephone conversation.
So there are many. It's just that we had challenges with so many things.
What were the challenges?
The challenges are we didn't have the kits. We didn't have the diabetic kits. They are so expensive even when we get them. And a lot of the patients could not even buy, and anytime they come, we have to check their sugar level, take their BP and their weight before they go in to see the doctor. And each time they come, they have to pay for a strip.
How much was it?
5 cedis for a strip.
Apart from that, what else were they paying for?
They were paying for their drugs. Sometimes they don't get their drugs in the hospital. When they get them in the hospital, they are free. But most of the time, they don't get them at the hospital. They prescribe for them to buy in drugstores, and a lot of them are not able to meet it. So in a month, somebody can go in a month without even taking the drugs, and then they will come back the following month, and it's so high. Then when you ask, they tell you they weren't able to purchase the drug because of its expensiveness. And those were the things. And they are not also able to comply with the diet. Diabetes is also all about diet. It's all about diet. But they are not able to comply with the diet. That was one of our major challenges. They don't comply with the diet at all. We tell them, all right, you can eat anything or you can eat everything, but in smaller quantity.
Were you regularly getting the strips and other items from the Ghana Diabetes Association?
Well, sometimes, not regularly, but sometimes.
Okay. And usually, what was the challenge with that?
The challenge with the strips.
Yes.
And that's what I say, it's sometimes expensive. If we get it from the diabetic in Accra, it's sometimes better. But if we run out and we have to buy from shops, it's expensive.
The case is not any different at the Komfo-Anokye Teaching Hospital in the Ashanti region. Former principal nursing officer at the Diabetic Center, Janet Obimpe, confirms that those in charge of the insulin brought to the hospital were selling it off to patients. This is not the arrangement under the Life for a Child program.
I quite remember once I asked where the insulin was coming from and then why were they selling it. And they told me that when it comes, they go there to retrieve the insulin and it comes with a cost. So they were subsidizing it to the clients. That is what I know about it.
When such a situation happened, what's the impact, or what was the impact you observed at that time?
Well, at that time, because the insulin in the government system was not coming, and this one was there and it was subsidized, the cost was a little bit low than those that they buy from outside. So those who could get the money were buying it.
And there'll be more on this particular investigation by Joy News, especially a response from Madam Elizabeth Daniel after we aired this report at midday and in our later bulletins.